No, but they needed to be categorized: high risk, low risk. The high risk ones were the people, the hospital staff, and each one of them had a case list, name, addresses, telephone numbers, and they were given this. Each one of them was then followed up. As at now, out of the 70, I think we're following up now 60, 63, because 7 of them are now in isolation.
7 of them?
Yeah, are now in isolation. So the remaining 60 are still followed up just to test whether they develop symptoms or not.
So just for the sake of clarity, those 7 are now confirmed to have Ebola, or they are isolated?
When they are isolated, they now take their blood samples to check whether they are infected or not.
Okay.
And once the result comes positive, they stay there for proper monitoring. The chances are you don't want to leave them with the normal public. Now, in addition to that now, I mean, the total now as of yesterday has been 10. 10. 2 of them have died. That's Sawyer and the other lady. So we have 8. All those 8 have been confirmed, tested positive. So they're still in Yaba.
Okay.
Okay.
So they're still in Yaba. Other case, subsequently, the next case now, for those ones who tested positive, the next line is tracing the secondary contacts
of those
people.
So it's methodical, because you can't afford to carry all of them, because you don't know who is positive or negative. So it's methodical, and we follow the same process. The challenge is how fast enough can you do that, because that is totally dependent on the human resource you have.
So how much human resource, because this is extremely critical, and this is part of the reason that the World Health Organization has declared this as a global emergency. So how much resources is at the disposal of Lagos State government and the healthcare or Ministry of Health?
Well, we have shortage. I won't doubt that.
Okay.
And that's why we've come out to ask for volunteers. And
what kind of volunteers are you looking for?
Well, I mean, anybody can, because you have different roles they can play. Some people can play a role in contact tracing, and some people can play a role in case management. People who already have how we manage them, and the isolation ward. Some people can play a role in just disinfecting areas, because if you go to a particular area now, you have a positive case. Once you move the person out, that place has to be decontaminated. You understand me? So you need people to be, or else if you leave it there.
Have we done that with all of the
every
cases
single
that we
area
have?
Have been to, like the first house to first consultant was decontaminated, even when Patricia's body was there. As soon as the body was back properly, it was decontaminated, pulled out. All the cases there, and the people who were in contact were counseled, all of them were treated the same way and were followed up. And that's why a number of them also developed that sin, and they were brought into isolation.
Is it true that the body was cremated as well?
That same night.
Okay.
Okay, now, Dr. Onokamaya, the government has said that any traveler coming into Nigeria and any passengers leaving Nigeria will be tested at the airport. What does this test entail, and approximately how long will it take, so that those who are planning to travel know how much time they have to give for this to take place?
No, you know, I said the most important thing here is sensitization, and once you sensitize, you have a high level of suspicious index. What they are doing at the airport is just to pick fever, and like one of the chairman said, so once they have that fever of above 38 degrees, you know, that is a case that you need to look further into. Not that they are taking blood samples for Ebola.
Okay.
At the airport.
Oh, it's a matter of minutes, seconds.
Yes. Yeah. It's just a scanner too, and you just get it. You get the value on the screen of the scanner, and
you move on.
Yeah. So if you have above 38.5.
Okay. Dr. Haribabu, the Nigerian government is talking to the U.S. government regarding ZMAP. Do we have any update as to their reaction, and what is the position now?
Yes, thank you. Like we heard President Obama said, this drug, for example, has not been tested, or had not been tested on human beings, ab initio. For the period the serum or whatever have been in stock, they had only been tested on chimpanzee, monkeys, and some other things. And there's a process which we call, control trial, for example, for any drug to come up. For example, the way human beings will react differ from person to person. And you know, this control trial must pass through a process. So that's why the President of America sounded as if he wasn't in a hurry to allow this drug come out for human use. Like we know, is it possible that after this drug might have done what we expected it to do on a human being, when in actual fact it had not been tested, some other things may come up in future that may even turn out to be worse than what we're looking at, for example. And so that's why he was talking about preventive measure, all these, you know, universal, you know, cleansing strategies and all those things will be more beneficial than this particular drug. Albeit, I think one take that we should actually, there's a little lesson that I begin to think we're learning now. Yes, universal hand wash, we've been sermonizing for long. We have to do this, not only for Ebola, maybe for some other things that we may not know. The virus is so small, it's not a matter of looking at somebody's palm and say, oh, you're looking so clean, you can't have Ebola, that kind of a thing. And besides that, you see the way our people also behave. People, but you know, say 3%, whatever, by research, had shown that people just do this, you know, defecation and urinating in public places. So to say, imagine a poor market woman just carrying the baby on her back and the chin-chin or whatever just drops down. She picks it in our usual way and blows it off, gives it back to the child. That's back. Who knows the last person who did the thing, whether the person is acutely ill or whatever, we can be sure of anything. But more importantly, our social habit will also have to change. I mean, what do I mean by social habit? Well, there are hospitality industry, for example, we have hotels that are standard and everything, but there are those local places where, maybe I'm sorry to say, artisans and other low-income group people want to go and start doing this thing they call short time or whatever. They might not change the beddings in 3-4 days. You never can know the last user, so to say. These are things we are trying to overlook, but they're quite important. And we begin to ask ourselves, also those who are so adherent to, you know, eating bushmeat or whatever. Even in Freetown in Sierra Leone, nothing is free there. You see free animal in the forest that is just dead on the ground. You say, nature has provided this, let me go home with it. Most of these things have to be done. But then this drug that's been tested, or that America has used their own citizen to test on, I begin to use the language, their own citizen. Maybe even if litigation or other things will come later, it's their own citizen they've started with, for example. I wouldn't want to believe that somebody is trying to maybe be selfish or whatever. I think they're also being careful to say this has only been tested on animals. While coming to human beings, let's be careful before we open the gate for the rest of the world. And the company is also saying it might take 2 to 3 months to produce even modest size, for example, for use. But imagine this thing multiplying or likely to multiply in geometric fashion than arithmetic. Like the Honorable Commissioner has just said, he mentioned about 70. We still could have the number that may not be very important contact, so to say, that may be multiples of that 70. I mean, it's a chain reaction. A child has had a primary contact, or for example, that child is going to school, has to mix with other many children. We're a country where we have congregation in churches and mosques in thousands. We are Catholic among us who will kneel down and take the Holy Sacrament or whatever from mouth to mouth. But this thing may not be as difficult and dangerous as we are looking at it. It may also not be as simple as we are looking at it. We don't need to create fear. I think washing and washing. The bleach system is there, which we have advised people. We can be using our resources to buy gloves.
Put a little bit of bleach in the water.
And you know, just soak your hand in 15 seconds or whatever. This thing, the virus will
So the bleach
succumb.
works.
Even temperature of 60 degrees centigrade, the virus will succumb.
But we hear that soap also works. Is that correct?
It does, not as much as bleach.
Okay.
Bleach is sure to kill the virus.
What about sanitizers?
Well, they do work. They are advisable. But more importantly, fumigation is also important. We have learned that about this, these fruit bats, for example, and some other rodents that may be around us. What about the nomads, people who are cattle rearers? The transborder movement can also happen. So these are things we should just be telling our people. But now let's just talk of one wash, you will wash and wash, but not salt and water to beat.
Let's stay with the
matter. You don't see there too.
We'll talk about the bitter cola and the
cola
cola itself. Yes, but Dr. Idris, when you're being a doctor, even if you're not a doctor, you know that when people are sick, they want just anything to make them get well. Yeah. But when you have an American government saying to you that this drug is not completely verified by the FDA, is not certified, is not ready for mass production and all that, but it's being tested on American citizens.